Hi, Nicole.
Hi.
Welcome back.
Thank you.
How are you doing today?
I'm fine.
Okay, you're fine. So you're here for another head-to-toe exam.
Yeah.
I know you were here last month. You have immaculate insurance, and it's just a really good plan that you have. So you want to stay on top of your health.
Yeah.
And you're here for another full body assessment.
Exactly.
We're very happy to have you. Can you verify your first and last name and date of birth?
Nicole Carcinello.
Could you spell that?
Carcenellio.
Okay.
And my date of birth is October 22nd, 1998.
Okay, that's great.
I know.
So, do you have any symptoms that you're experiencing today, or you're just here for the whole head-to-toe exam?
I want that exam, but I've been feeling weird in my feet down there.
Okay.
Like some tingling feeling.
Tingling in your feet?
Like pins and needles.
Okay, that's
So
strange.
It's been very weird in both feet at random times of the day.
Okay.
And then also, like, my upper back has been bothering me. Like, oh,
Okay.
yeah.
So, do these symptoms start together, or do you think that they're separate? Do they start around the same time?
I think they're separate, but it's hard to say. The feet started first, the back number 2.
Okay. And then, again, tell me, how long has this been going on?
3 days.
Okay. And with the feet, so it's pins and needles, it's tingling. Do you feel numb at all?
Yeah, I feel numb after the pins and needles. Like, I can't feel my feet, and so I'll be walking, and then I think, like, am I walking or not? Because I can't feel it.
You don't know whether you're walking or not?
Well, like, I know I am, but I don't know because I don't feel it.
You don't know for sure.
Yeah.
If you're walking or skipping or sitting, that is concerning. And with the back pain, do you remember lifting anything heavy? Because the symptoms you're describing in the upper back, the dorsal muscles, that can a lot of times be attributed to lifting a very heavy object.
Yeah, well, I'm really into my church, so
Okay.
I've just been lifting a lot of spirits lately, but nothing heavier than that.
Okay, so lifting spirits. Okay, so spiritual lifting. So in church, whenever you...
Hallelujah.
Hallelujah.
Amen.
Okay.
Thank you, Jesus.
So you raise your hands a lot?
Yes.
Okay. Do you do this vigorously?
At Mass, yeah.
Okay.
I take part in everything.
And there was never like one church service that you feel like you went too far, or you made a very sudden movement?
I always try to go over the top.
Okay.
So, every service.
Every service?
Yeah.
Okay. Well, that's a great thing to be involved spiritually and to be close to God, and I'm a huge advocate of that. However, we do want to make sure that your body is in shape and that you're not overexerting yourself. Okay. So I'll be doing some examinations with that. Any other symptoms or family history that you'd like to update since last time?
Family history. No.
No.
And the other one, no.
Okay. Any medications that you're taking on a daily basis?
My daily vitamin.
Okay.
Women's Multivitae. That's
Okay.
the brand name.
Multivitae? Okay. Never heard of that one. Okay. How's your sleep?
You know, when I'm at home, sometimes I find it hard to sleep. My mind is racing with thoughts about how I can be more involved with my church and service, and also with my family and my friends. But outside of that, like, I can get 5 or 6 hours of sleep.
That's great. So in terms of racing thoughts, before we go into prescribing sleep medication, sometimes I like to recommend melatonin or valerian root, or a combination of the two that can really help.
Okay, what if it's homegrown?
Homegrown valerian root?
Yes.
I've never heard of it. I've never tried it, but Are you a gardener?
Yes.
Okay, well, if that's...
I would love to garden it if I can.
Yeah?
Yeah.
I don't know where you would buy those seeds, but I encourage you to experiment if that's something that brings you personal enjoyment and fulfillment. Gardening is very therapeutic.
Yes, thank you. I'm very eco-friendly in that way.
Okay.
Reduce, reuse, recycle.
Eco-friendly. Wow, look at you. You are an upstanding member of society.
Thank you.
Okay. If you have nothing else to say or report, I'm going to go ahead and take your vitals just to make sure you're doing okay with breathing, blood pressure, and then we're going to do your feet, followed by a quick cranial nerve exam, and we'll focus on your back as well, okay?
Okay.
Oh, one more question. Are you doing anything for the pain right now?
Meditation.
Okay. So no over-the-counter ibuprofen, Advil?
No, just my home gardening.
Okay. All right. Great. So first I'm going to listen to your heart and your lungs. So just make sure you're in a relaxed space. Uncross your ankles for me. I'm going to start with your heart. Any rapid heartbeat, dizziness on standing? No, that's good. Okay. So just relax. Heartbeat's also normal. I'm going to listen on the bell side, just flipping it over, listening for murmurs or extraneous sounds. Okay, good. Go ahead and just move your arms a little bit. I'm going to listen to your lungs. Okay. Sounds very healthy. I'm going to listen to your blood pressure. Go ahead and give me your arm here. Good. Keep those legs uncrossed.
That's tight.
Oh, I'm sorry. Sorry. Oh, wow. Okay. Release the pressure now.
Thank you.
There you go.
I have this one at my house too, but I never did it that tight before.
Okay. All right. Sorry to bring you discomfort there. Okay, it looks like it's 120/80, so perfect. Very good blood pressure. Just going to slide this off. Excellent. Going to take your temperature.
Okay.
Okay, it's a little high. You're at 100. Do you have any?
Really?
Mm-hmm.
Oh my gosh.
Don't worry about it. It's okay. It's a hot day.
It is.
Are you feeling hot today or feverish or flushed?
No.
Okay. We can double check it later. And lastly, we're going to take your oxygenation by giving your index finger. Perfect. And just we're going to hold it here. Okay, this can't be right. It says your heart rate is 110 beats per minute.
Yeah,
your blood pressure was normal. You don't
nervous.
Okay, all right, so you are nervous.
Yeah.
Well, your oxygenation is normal. It's 96% at room air. Yeah, now it says it's at 112. Wow. There might be something wrong with the machine here. Okay, but we can double check that later as well. Okay. Okay, we're going to do the cranial nerve exam with you laying down, but real quick, I'm just going to feel your face for any kind of contusions or concussions, just because you did mention with your back problems, I want to make sure there's no signs of a fall that you didn't remember. Do you sleepwalk at all?
No.
Okay. Okay, and as I bring my fingers from the bridge of your nose to your ears, do you feel it all the way? So starting now and ending at the ears.
Yes.
Did you feel it on both sides of your face?
Yes.
Did you feel that equally?
Yes.
Okay, we're going to do a little bit lower here. Same thing, starting now. Stopping. Did you feel that all the way?
Yes.
Good. Equally on both sides?
Yes.
Good. And to your chin, starting now. Stopping. Did you feel it all the way?
Yes.
And equal on both sides? Okay. Okay, I'm going to do your forehead now. Starting. Stopping. Okay, good. Okay, I'm just going to feel your thyroid here. Very healthy. Preauricular lymph nodes are intact. And your postauriculars. Okay, very good. Look to your left for me, turn your head. Okay, good. Turn your head to your right. Okay, good. Look up for me all the way. Okay, and look down. Resist my push. Very, very strong. Okay, so go ahead, lay down on the bed, get comfortable, and I'm gonna go ahead and examine your feet. Okay, okay, Nicole. Now, do you mind if I remove your anklet?
It's actually a permanent piece.
Okay, well, I'll leave it on. I'm just going to go ahead and palpate the feet to see if there's any lumps or bumps or inconsistencies that I see within the pads or the toes. Okay, so just lay back and relax. And let me know if you feel any sharp pain.
It's a little numb there.
A little bit numb,
Yeah.
like you're not feeling as much.
Yeah.
Okay. So your rotator here seems to be just a little bit inflamed. I'm going to look with a pen light to see if I notice any discoloration. notice any purpling of the skin. Just want to look in between your toes. Just going to see if there's anything that I see that's alarming here. Okay, now I'm going to just squeeze different parts of the foot. I want you to let me know if you felt once, twice, or 3 times, okay?
Okay.
So this is once, this is twice, okay?
Okay.
All right, I'm just getting an assessment of your level of numbness, so this test should be pretty easy. Okay. Once. Once.
3 times.
Good.
Twice. Once. 3 times.
Good.
Once, I think. Once. Once.
Okay.
Once. 4 times.
Good.
1 time. 1 time. 3 times. Once. Twice.
Good. Okay. Be going on the individual toes, just squeezing again very gently. If you feel any pain, let me know, but otherwise say once, twice, or 3 times.
Once. Once. 4 times. Once. Once. Twice. 3 times.
Good.
Once. Twice.
Okay. Just continue here and palpate the right foot. Don't feel any excessive warmth. I don't feel swelling, which is very good. Just this area right here seems to be a little bit irritated. I'm just feeling a little bit of warmth there, but nothing too alarming so far.
Yeah, I think my left foot is a little bit numb now because I have pins and needles.
Right now?
Yeah, it's been numb for a bit.
Okay. Okay, some slight discoloration. Seeing a little bit of sand here. Did you go to the beach recently?
Yeah, I was at the pool.
Okay. Just going to be putting a little bit of cleanser on the feet before I begin the sensory tests. Okay, it's just going to be a little bit cold. Just want to get rid of any excess debris that might interfere with your responses to the test, okay? Just gonna wait for a while while that soaks into the skin. So you said right now you're just feeling it on your left side.
Correct.
Okay. Going to just rubbing this in with a tongue depressor here. Just give it moisture. Okay, and just for a brief moment while that settles in, I'm going to do some measurements of the feet just to compare metrics and see if one foot is more swollen than the other, as I suspect the left one is. Okay, you're still comfortable, right? Yes. Okay, good. Okay. Good, this is 11 inches. About a 26 centimeters in the center. Just going to be writing that down. The other side. It's about, okay, so this is 10. We only have about 25.5 centimeters, which means your left foot is a little bit swollen. Just writing that down. I'm going to be going right from here to the toes. That's about 5.5 inches, and it's about 13 centimeters. Okay, and on the other side, it's about, about 13.5 here. So this left foot is taking up a wider area, which could mean that when you're wearing your shoes, the left shoe you feel more constricted in,
Okay.
which results in the numbness and tingling. Now, you said it was happening in both feet.
Yeah.
So I don't know if this is the culprit or not, but just to keep in mind,
Okay.
it might be time to buy some wider shoes just to compensate for that extra surface area.
Okay.
Okay, I'm going to just take a quick sample of some debris right here in the middle of the toes that might be fungus related. I'm not sure. Have you been having any itchiness?
A little bit,
Okay.
but nothing crazy.
So no extreme itchiness, but some light itching. What about any residue, any discharge in the feet?
No.
Okay, that's good. I'm just going to make sure that you're not having a bacterial infection here. Just bear with me. Just going to feel like a little tickle between the toes. Sorry about that. Okay. Just going to get right here. Okay, beautiful. Okay. The next sensory test is going to be vibrational. I want you to let me know when the sound starts and when it stops. Not when the sound starts, when the vibration starts and stops. So go ahead and ignore the sound. And when you feel the vibration on your feet, say started. And when it stops, say stopped. Okay?
Okay.
Okay, good.
Stopped.
Okay. Did you feel it starting?
No.
You didn't feel it starting at all? Okay. All right, so go ahead.
Actually, yes.
So go ahead and say started and then stopped.
Started.
Good.
Stopped.
Okay, you were a little bit early on the stoppage. Just gonna write that down.
Started. Stopped.
Okay.
Started. Stopped.
Okay, I wasn't doing anything.
Oh, really? What?
Yeah, so this is not good for your test. The test just took a turn. It's not going well. It's not going as well as I hoped. But let's go ahead and do it again. Okay?
Started. Stopped.
That's great. Good job. Okay?
Started. Stopped.
Good. I'm just going to lean your toes this way. Good. And again.
Started. Stopped.
Good.
Started. Stopped.
Good. Okay, you're going to move on to the ankle area.
Started. Stopped.
Okay, you were a little bit short there, so I think you are struggling with vibrational sensations, which tells me that you might have a deep tissue issue.
Okay.
Okay,
Started. Stopped.
great. Okay, I'm gonna go ahead and just use a different instrument here. Same test, started and stopped.
Started. Stopped.
Not quite what I wanted, but
Oh,
no, it is what I wanted. I want to assess your level of numbness, but it seems to be pretty severe. Okay.
Started. Stopped.
Good. Okay.
Started. Stopped.
Good.
Started. Stopped.
Good.
Started. Stopped.
Mm-hmm.
Started. Stopped.
Okay.
Started. Stopped.
Yes.
Started. Stopped.
Much better.
Started. Stopped.
Okay.
Started. Stopped.
Good. Okay. We're gonna go ahead with a sharp or dull test, okay?
Okay.
So, do you feel this sensation here?
Yes.
That's a sharp sensation, and this will be soft. So go ahead and say sharp or soft, depending on which one you feel. Try to do your best, but be honest, okay?
Okay. Sharp. Soft. Soft. Sharp. Soft. Sharp. Soft. Sharp. Soft. Sharp. Sharp. Soft. Sharp. Sharp. Soft. Soft. Weird soft.
Weird?
Yeah, that was a weird one.
How weird how?
Like a snake.
I felt like a snake.
Yeah.
Was it slimy?
It was soft.
Okay.
Soft. Sharp. Soft. Soft.
Good.
Sharp. Soft.
Good. Okay. So next we're going to do a pressure point test, but I'm going to be using sensory brushes, okay? So you're going to feel either one sensory brush or two. Go ahead and say one or two, depending on which one you feel, okay?
Okay. One. 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 Two.
Okay.
Two. One. Two. 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 One. One. Two. 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 One. Two. Three.
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 Okay. All right.
Two. Two. One. 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 Two. One.
Okay. So that was pretty much inconsistent. Are you okay with laying on your stomach so I can look at the back of your feet?
Sure.
Okay, we're going to go ahead and do that, and I might apply pressure point treatment to just realign some of the tension that I feel, especially in this left leg, okay?
Okay.
I'm going to go ahead and just apply some more of that ointment to the bottoms of the feet. Okay. Just going to be feeling the bottoms. Okay. So is this area numb here when I press?
No.
Okay. What about when I go down here to the very ends of your heels?
No.
No, that's good. Okay. We're going to do the squeezing test again. Go ahead and say once, twice, or three times, okay?
Okay. Once. Twice. Three times.
Okay. I'm going to bring your other foot up.
Twice. Once. Once. Once.
Okay. So I'm going to be squeezing either your right or your left foot. Go ahead and say right or left, all right?
Right. I didn't feel anything.
Okay.
That's right. I mean, I hear your glove, but I don't feel anything.
You don't feel anything? That's the left foot. Okay. So
Yeah, my left foot's really wonky.
Yes, I can tell. So I'm going to be doing some work there right now. I'm going to be using a chiropractic activator tool just to relieve some of the tissue around the area to jumpstart the healing process. It's not going to feel painful at all. It's just going to feel like a pressure. It might feel a little funny, and since you're numb, you might not feel it at all at first. Okay?
Okay.
But do let me know if you feel any pain. Okay?
No pain.
No pain?
No.
Do you feel it at all?
Yes.
Okay.
Oh, I feel the pain there a little.
You feel it? It's been painful?
A little.
Okay, I'm going to go a little bit lighter, but the fact that you're beginning to feel things is a good sign. It means that some of the sensation is returning, which means the tool is doing what it needs to do. I'm just really getting the pressure points along the ankle. Go back to this left one here. I think I've gathered the information I need to gather about your left leg.
Okay.
It's doing pretty poorly, but hopefully the treatment that I applied will be helpful.
Yeah, I think it's already feeling a little better.
Okay, great. So I'm going to go ahead and continue with the quick cranial nerve exam just to assess your eyes and ears, make sure that everything's going good there, okay?
Okay. I'm really excited. I love these exams that you do.
I'm so glad. I'm so glad.
Yes.
I can tell you come back very often.
I do.
Yes. Okay.
Of course. How could I not?
Okay, now go ahead and look at your eyes. Go ahead and pick a point in the wall, stare straight ahead. Okay. Okay. Go ahead and look up for me. Look down. To your left. To your right. Okay. I'm not seeing any jaundice or irritation. No signs of infection or veinage. I'm going to go ahead and look at the other eye and look straight ahead for me again. Look up. Look down. To your left. To your right. Okay. Now look at me. All right. Was that painful at all?
No.
Okay. So I'm going to be bringing my fingers into your field of vision. Whenever you see my fingers, go ahead and say now. Go ahead and stare straight ahead, okay? Good.
Now.
Good.
Now. 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 Now.
Okay, go ahead and look at me. Okay. Let me know which fingers are moving. The fingers on your left or your right?
My left. My right. Both. Left. Right. Both.
Good, okay.
Okay.
Do you have any experience recently with blurry vision, double vision?
No.
No. Okay, so your eyes are doing pretty well?
Yeah.
Okay, I would think so too. I'm going to go ahead and take a Stellan chart and just test that real quick, okay? Look at this chart. Go ahead and read this row for me.
OLCF.
Good. Could you read it backwards?
FCLO.
And that last row?
LTFPH.
Okay, and could you read it backwards?
HPFTL.
Okay. Which number is larger, number 9 or number 8?
9.
Number 7 or number 4?
7.
Number 5 or number 2?
5.
Okay, very good. Okay. I'm going to go ahead and look inside your ears now.
Okay.
Okay. go ahead and look straight ahead. I'm going to look inside your ear for any signs of infection or scarring.
Okay.
Anything along the ear membrane. Are you having any ear pain?
A little bit.
Okay. A little bit. Is it when I tug on the ear, or is it a more inner ear problem?
I think it's inner ear.
It's in your inner ear?
Yeah.
Okay. Are you hearing things that aren't there? Are you
No.
Are you having like a loss of hearing?
No.
Okay. Describe your symptoms then.
I am just paranoid. I think that's what it is. I'm very paranoid.
So how does your paranoia translate to ear problems?
Well, I think I feel it, but I don't know if it's real or not because I get paranoid.
Okay, feel what?
The pain in my inner ear.
Okay, so there's a pain.
Yes.
Okay, so there's a pain in your inner ear. Is it ringing? Is it just a pain? It hurts?
I think it's just a pain. I'm really paranoid.
Okay. I can refer you to a mental health practitioner if you're having some issues with anxiety, paranoia, things like that.
Sometimes, yeah.
Her name's Dr. Katie. She can help you with that.
Is she Katie ASMR?
No, this is a different one. Yeah. And so, but I'm going to go ahead and look at your other ear just to make sure I'm not seeing any signs of infection, so that's good.
Okay.
But I'm glad you told me about the symptoms. Straight ahead. Okay, I'm just going to look inside this ear. No issues here. Okay.
Thank you.
Go ahead and close your eyes. Let me know which ear you hear the rustling sound, your left or your right.
Left. Right. Both. Left. Left. Right. Both.
Okay. I'm gonna give you a couple scents to smell, and we're gonna wrap this baby up.
Okay.
Okay. So go ahead and inhale. What does it smell like?
Lavender.
Peppermint. Not correct so far. Go ahead and inhale.
Orange.
Vanilla. Okay. Go ahead and inhale.
Kiwi.
Okay. Well, that was orange. Okay.
Gosh.
All right. Just one more.
Pumpkin spice.
That was rosemary spice, okay? So I'm gonna write you a bunch of referrals. I think your problems are beyond my control. You have a lot of issues with numbness in your feet. You're not smelling things correctly. You have numbness and tingling. So we're gonna send you to get a bunch of tests done.
Okay.
Hopefully this is just something connected to the foot pain, and it's just kind of throwing off your whole body. But we're going to just make sure, because you have great insurance, okay?
Okay.
So I'm going to write you that referral in the front.
Okay.
You seem to be doing well. You're smiling. I'm glad that the pain isn't taking away your love for life. And please come back. We're going to schedule a follow-up for next week, okay?
Thank you, Katie ASMR.
All right.
Thanks.
Bye. Okay, just going to take a look at the feet. Do have a little blister here. Looks to be healing nicely. Were you wearing a pair of shoes that were?
Yeah, the shoes that hurt my feet.
Just make sure to apply Neosporin from this point on and just give your feet a rest from those shoes. Just looking between the toes for any debris or
signs of fungus. I don't see anything here. I'm going to apply a cleansing flow and also a wipe. Okay. Just to clean the area. I'm seeing a little bit of redness. Just a little bit of swelling around the ankle. Not fine, just a little bit of treatment there. And the serum. Just to hydrate the area. Okay. Feeling for any lumps or bumps. Got my callus here. So just some evidence of improper footwear, and that might be contributing to the discomfort. Continuing with the palpations. Okay. Do you patient on your left or right foot? Left. Left or right? Right. Okay. Left. Okay. Right. Good. I'm going to do a pressure point test. This is 1 pressure point. This is 2. Say 1 or 2, okay?
2, 1, 2, 2, 2, 1, 1, 2, 2, 2, 2, 2, 1, 1, 1, 1, 2.
Okay. And same with the test on your face. You know when the vibration sensation stops, say now.
Now. Now. Now. Now. Now. Now.
Okay. We're going to check your pupils. We're going to end with sharp or dull on the feet.
Okay. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Sharp.
Good.
Sharp.
Good.
Dull. Dull. Sharp. Dull. Dull.
Okay. Okay, Ginger, that concludes our session for today.
Okay.
I did notice some redness in the feet. I'm going to just give it a rest, give those shoes a rest. And I'm going to send the samples that we collected from your scalp. And I'll be calling you in a few days to ask you how your symptoms are going and the next steps. I do have some serum that I applied today that I'm going to send you home with. But other than that, you're perfectly healthy.
Thank you.
Okay, great. Nothing in your socks. Go ahead and just rest your foot right here on my knee right here. I just want to. Okay. Just going to take a sample just to make sure there's nothing in between the toes. And the back of the feet. Oh, I'm so sorry. We're gonna have to do that again, man. I'm so sorry. This is very tedious, but hopefully your plane isn't leaving right now.
Yeah, we're kind of cutting it a little close.
Okay. Well, hopefully they'll hold the plane. Usually Kitty Airways is good about that. Okay, just... Okay, just going to put this in here. Okay, go ahead and can I see the other foot, please? Just going to take the sock off. Okay. I'm not seeing any issues. Looks pretty standard. Follow the feet. Alright. And then we're just gonna take a quick sample. That's what we're gonna do. Going to just put this in here. Okay, so that's done.
Great.
Next, I'm gonna go ahead and take a look at your backpack, okay? And then we'll send you. Okay, flipping it over, listening on the small side, just to listen for any murmurs. I like that necklace you have on. It's very cute, very cheerful. Okay, I'm going to go ahead and listen to your sides. Okay. Okay, give me another deep breath. Any difficulties in taking deep breaths?
No.
Okay, it sounds very clear. Listening to the other side, just give me another couple of really nice deep breaths. Okay. Excellent. Oops. Okay, everything sounds normal with your lungs and your heart. Okay, I'm going to go ahead and grab your blood pressure. Your shirt's thin enough. I don't think we have to move it. Okay. Make sure your legs are uncrossed. Actually, I'm going to just lift your shirt just a little bit. Perfect. Okay. That's 120/84, so that's definitely within the normal range. I'm gonna slide this off. Any history of high blood pressure in your family? Okay. Okay. Go ahead and give me your index finger so I can look at your oxygenation. Okay. Your oxygenation is great. It's 99% room air. Heartbeat is 88 beats per minute, and that's normal. Can we take your temperature now? .7, perfect. All right. So now that we have your vitals, I'm going to have you just get comfortable, lay down, and I'm going to just palpate the feet. Go ahead and look at it under a light and see if there's anything I can find. Okay, so I'm sanitizing my gloves. Okay, I'm just going to gently peel off your socks. They look very warm and cozy. Okay, let's take this one off too. Okay, I'm going to just do an initial inspection here. Okay. Looking with a pen light. Also just doing a visual examination of the feet with the naked eye. I'm just looking for anything topical on the skin, like a wart or fungus, which I don't see. I do see that the skin is very dry, but that is common. I do see a slight abrasion right here. This is on that left side that you mentioned. Okay. So what I'm going to do is some gentle pressing, and I want you to let me know if you feel pain or any kind of numbness. Okay, we're going to focus on different areas of the feet, okay? Okay. Pain here?
Yes.
Okay, what kind of pain is that?
More like sharp and shooting.
Okay. What about here on the toes?
A little bit.
A little bit of pain?
Yes.
Is it the same as the pain here on the pads of your feet?
Yes.
Okay. Drawing my fingers down to the center. Any pain?
No.
Okay. And what about here on the heels? Any pain?
Yes.
Okay. Is it the same kind of shooting pain?
It's more of a dull pain.
Okay. So what I'm going to do is just take a couple of samples of the slight debris that I see in between the toes. Okay. Just to get a good idea of the skin. Okay. I know that it's a bit painful, but I'm still going to be palpating the feet. I'm just feeling for anything that sticks out in terms of swelling or any kind of bone misalignment. I'll be able to tell just by palpating the feet. Okay, I'm feeling a bit of swelling and pressure here on the top. Go and lift the foot gently, just so I can get a good idea of the tops of the feet. I'm not feeling any kind of protrusions of bone or misalignment of the pedal structure. Okay. I'm just testing to see if there's any stiffness in the toes. It seems to be working well. Okay. And then just moving on to the other foot. Is it the same level of pain here on the pads?
No, it's a lot less.
A lot less. Okay. So definitely I'm going to be focusing on that other foot. What about here? Less or more?
Definitely less.
Okay. Going down a little bit. Pain or no pain?
Not as much, no.
Okay. Any numbness on the feet?
A little bit.
Just a little numb on this side. Okay. It's good to know. I'm going to go ahead. Take a sample here. Just of this area here. Especially this area looks like a healing abrasion. Doesn't look to be actively infected. Just gonna look at that with the light and see. Looks to be definitely blister, definitely healing well, so I don't think that's the cause of your problems. I'm just gonna get right here in this spot where it was though, just to make sure that we don't have an active infection. Okay. Now your feet are very dry. I'm going to go ahead and apply just a little bit of moisture to help with that, okay? Before we begin the sensory test. So it's going to feel a little bit like a menthol kind of cool sensation, but it's going to really help, I think. Okay. Just working to solidify that this moisture is seeping into the skin by activating pressure points here. Not a clinic that specializes in reflexology, but definitely knowledgeable of the points of the feet that are strained and can affect the organs. So I'm just gently hitting those and let me know if it gets too painful.
Okay.
be using a massage tool that is compatible with the lotion or the ointment that I applied, just to kind of help massage the tension that I feel. Try to go this route before prescribing over-the-counter medications. Okay, so next I'm going to just do some percussions on the feet. We're going to move on after that to sensory tests. Just checking your reflexes here. Any pain here on the side? No. That's good. It's good that the ankles aren't affected. Okay, everything feels normal, albeit a little bit swollen. I'm going to do a few sensory tests. Okay. This is a sharp sensation, and this is dull. Do you feel the difference?
Yes.
Okay, go ahead and say sharp or dull.
Sharp.
Good.
Dull.
Good.
Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Dull.
Okay.
Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp.
Good.
Sharp.
Good.
Dull. Sharp. Sharp. Dull. sharp, 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 dull, 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 sharp, sharp. Okay.
A lot of those were incorrect, so you're definitely experiencing some significant numbness. Okay, just going to do some quick measurements of the feet to see if they are the same size or if one is more swollen than the other. This is 8 inches in the center. It's 9 inches here. So the right side is a little bit more swollen. Okay. 3 inches here. 3 inches here. Okay. Just going from this side to the top. Somehow, this side to the top. That's about 8 inches each. Okay. All right. So, just have a little bit of clarifying water just to wipe off the oil before we move on. It's going to feel cool. I just don't want to leave you with sticky feet. Okay. Definitely got some dirt and debris there. Let's use one more cloth. Okay. I'm going to go ahead and put on some different cloths because we're going to move on to just examining the legs and abdomen, okay? You can stay right where you are. You're doing great. So I know you're comfy right now. I'm going to go ahead and lower the blanket and with your permission lift your shirt so I can do some palpation. So you can go ahead and relax. I'll do it. There we go. Okay, just want to get this so. Okay. Any abdominal pain?
No.
That's good. Just going to gently lift the shirt and lower your pants just a little bit. Okay. Normal regurgitation sounds of the stomach. little excess noise in there. Okay, everything sounds healthy. Just going to be doing some palpations next, okay? Do you have any history of acid reflux or stomach issues?
Yeah.
A little bit?
Yeah.
Okay, but it's not bothering you today?
No.
Okay. I did hear a little bit of fluid buildup in the stomach, but other than that, everything seems healthy. Your organs feel very healthy, normal in size. I'm just gonna feel the pelvic lymph nodes. Okay, very good. Going to do a pressure point test on the stomach, okay? So this is one pressure point. This is two. Do you feel the difference?
Yes.
Okay, go ahead and say one or two.
1, 2, 1, 1, 1, 2, 2, 2, 2, 1, 1, 1, 1, 2, 1, 2, 1, 2, 1.
Okay, very good. Just gonna go ahead and put this down. Now, Lori, raise your blanket a little bit so you're comfy. Next, we're going to go ahead and move on to just a cranial nerve exam. Go ahead and stay where you are. You're in a perfect position. Okay, so we're gonna do just a simple visual series of tests. Okay. I want you to let me know when the light enters your field of vision. Say now. Pick a point on the wall and don't look away, don't move your head, just say now.
No.
Okay.
No.
Okay.
No.
Okay.
No.
Okay. Good.
No.
Okay.
No.
Okay. Sorry about that. It's a little bright. So. Next we have a light that's a little less bright. I want you to go ahead and follow it with your eyeballs for me.
Okay.
Don't move your head, just follow with your eyes. Good. Excellent. Okay. Any changes to your vision or blurry vision?
No.
Okay. Do you have a history of color blindness?
No.
No? Okay. I'm going to show you an instrument with a series of colors. This is
Red.
okay. Go ahead and tell me what color this is.
White.
What color is this?
Green.
And the color above it?
Red.
And the color above that?
White.
What's this color here?
Green.
Color here?
Orange.
And what about this strap right here?
Pink.
Good. And this one?
Green.
Good. And here?
Orange.
Excellent. Let's go down here to the stem. There are kind of two colors here.
Pink and white.
Okay, good. What about these two?
Blue and red.
Good. And what about these two?
White and green.
Good. Okay. And the strap down here.
Blue.
Okay. And this right here?
Green.
Good. Excellent. And go ahead and write that down. You're seeing colors very well. I have just a few more colors for you to do your best to differentiate for me. Okay. This color here.
Pink.
Good. This color here.
Purple.
Good. This color here.
Blue.
Excellent. And what about here?
Orange.
Good. And here?
Green.
Yes. And one more right here.
Yellow.
Very good. So we're a little colored egg set for you. Okay. We're going to move on to a simple hearing test, okay? Just want to make sure that you're hearing things correctly. Close your eyes for me. You're going to feel a rustling sensation. I'm going to be making it with my gloves. Let me know if you hear it in your left or your right ear.
Left. Right. Left. Left. Right. Both. Left. 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 Right. Left.
Coming a little bit closer, I'm going to whisper some things in your ear. Repeat exactly what you hear after me. Okay. Snails.
Snails.
Kitty cats.
Kitty cats.
Josie B. ASMR.
Josie B. ASMR.
Flowers.
Flowers.
Butterflies.
Butterflies.
Boyfriends.
Boyfriends.
Girlfriends.
Girlfriends.
Chandelier.
Chandelier.
Grapes.
Grapes.
Oranges.
Oranges.
Curtains.
Curtains.
Scissors.
Scissors.
Snip, snip.
Snip, snip.
That was perfect. That was
Yay.
a perfect performance.
I aced it.
You aced it very well. I'm very not concerned. I'm unbothered by your hearing. So we're going to move on. I did change my gloves, so don't worry. I'm going to be palpating your face next.
Okay.
Okay, you can just get comfortable. Keep your eyes closed. Do you feel pressure on both sides of the face as I did that?
Yes.
Okay, did you feel it equally?
Yes.
Okay, I'm going to start from the center, go to the side. Let me know when the sensation stops on both sides.
Stop.
Good.
Stop.
Good.
Stop.
just continue to palpate, feeling the preauricular lymph nodes, and they are non-palpable. Next, I'm feeling the postauriculars behind the ears. Go ahead and tilt your head slightly this way. Good. Non-palpable. I'm going to be pulling on your ears. Let me know if I'm pulling up, down, back, or forward.
Up. Out. So sideways. Forward. Down.
Okay. Any pain or pressure when I did that?
No.
Alright, let's do some facial myotones. So go ahead and try to move your head to your left. 3, 2, 1. Good. Come back to center. Move to your right. 3, 2, 1. Move, move, move. Good. Do the same thing. This time I'm putting my finger right here on the bridge of your nose. 3, 2, 1. Push against me. Good. Nice and strong. 3, 2, 1. Push against me. Good. Now try to open your mouth. Good. Just putting pressure against the jaw. Now open your mouth all the way. Wide, wide, wide. Try to close it. Good. Okay. Try to lift your eyebrows for me. Good. Now lift them all the way. Trying to lower them for me. Oh, very good. Okay. Not too concerned so far. I'm going to just be doing some percussions. Let me know if you feel pain. Okay. Not seeing any issues there with the face. Going to do a warm or cold test before moving on to the scalp, okay?
Okay.
Alright, so this is going to be a cold sensation. It'll be a cold sensation. My finger won't be warm. Say cold or warm. Keep your eyes closed. Cold. Good. Warm. Good. Warm. Cold. Good. Warm. 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 Cold. 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 Warm. Cold. Cold. Good. Cold. 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 Good. Excellent. Now I know you said you didn't have any kind of issues with the scalp. I'm going to go ahead and do a quick check anyway because that's what I do. Okay. I know you mentioned last time that you have sensitive hair, so I'm going to be gentle. I'm going to avoid any hair pulling. Just going to inspect the oil glands. Go ahead and turn your head this way if you can. Perfect.
just inspect the part. I don't see any dryness, no scaly patches. A little bit of freckling. A couple very light sunspots, but no issues with moles or any troubling spots that I see. Okay. I'm going to do a sharp or cold test. Okay.
Okay.
This is cold.
This is sharp.
Okay.
Okay. Cold. Sharp. Cold.
Good.
Sharp. Cold. Sharp. Sharp. Cold. Cold. Sharp. Sharp. Cold. Sharp. Cold. Sharp. Sharp. Sharp.
Excellent. Okay. Thank you. Go ahead and lift your head, sorry. Go ahead and lower it. Okay, Casey. So that concludes our exam today. Everything looks really good. Your feet are swollen. There's probably something internally going on. But internally it's not serious. Okay? So we're going to get the test back and see if there's any kind of fungus. And if there's not, we're going to wait a week and we're going to see if it goes away. And if it doesn't, we're going to put you through some tests.
Oh.
Some tests with the big scanner. We're going to scan you.
Oh.
Scan you like a grocery store item.
Oh, wow, yeah.
Okay. And so we're going to get to the bottom of this, basically.
Okay, well, that's some good news.
Great. All right. Well, let me know if you have any questions in between then. Thank you for allowing me to do this exam, and it's been a pleasure.
Thank you.
Okay. I have these toe cushioners. They're just going to help to keep your toes aligned as I examine the lower legs. It's going to feel just a little squishy, but it should be very, very comfortable. Okay, very good. Okay. So I'm going to just gently lift some of the leaking here just so I can better visualize. If it becomes too much of a circulation issue, definitely let me know that. Okay. Is that comfortable for you?
Yeah.
Okay. Okay. All right. And again, with a strengthening exercise, I want you to bring your legs outward. Try to spread them for me. Okay, bring them inward toward each other. Good. Now try to lift them in the air. Okay, a little weaker there. I'm going to lift them for you. Try to bring them down. Very strong. Right. Let's do some pedal exercises here. Try to bring your feet in toward each other, just the feet. Good. All right, try to bring them outward. Now could you flex your feet? Like try to raise them up. Okay. Try to push against my hands. Okay, try to lift them up towards yourself. Okay, and press down with your heels right now. Okay, just going to feel for any swelling. Don't feel any signs of edema here. Again, with some tightness on the left side. Your skin seems to be a little dry, and I'm going to do some massage work. So I'm going to put some oil on your legs, okay? Just trying to get that tightness down. I'm going to do a little bit of cupping. I might have a little bit of redness for a few days after this, but it's going to go away and it's just blood. trying to circulate blood in the front calves before I have you turn around. I'm just activating some pressure points here. Okay. Okay. I'm gonna have you go ahead and turn around facing down. Hi, Matty. How are you?
I've been a little bit better.
Okay. Tell me what's going on.
I'm having some knee pain.
Okay.
And it's really hard to walk.
Is it this right knee here?
Yes.
Okay. When did that begin?
I would say about a month ago.
Okay. Do you remember spraining it or any issue that might have provoked this?
Hard to tell. Being so busy all the time and running around, I just didn't pay attention. Then one afternoon I noticed that I'm limping.
Okay. All right. Do you exercise?
I do, yeah.
Okay. And how's exercise been since this injury happened?
Very hard. Upper body, and that's it.
Okay. Have you taken any rest?
Yeah.
Okay, good. So I would completely rest that knee to the foot until we find out what's going on, okay?
Yes.
All right. So are you wearing any new shoes?
No, same shoes.
Okay, so it would not be an issue with shoes. Is it like a numb? Do you ever feel numb or tingly?
Pain.
Okay, so just pain. Does it radiate?
It does, kind of like towards the back of the knee.
Okay, so it's mostly in the back?
Yeah.
All right. And on a scale of 1 to 10, how bad is it right now?
About 4.
It's about a 4. Okay. And how bad is it when it gets at its worst?
8.
Okay. And is it worse at any time of day?
No, it's just worse. Like even at night, it wakes me up.
Okay. Do you have any allergies to medications?
Penicillin.
Okay. Okay. Any other changes in lifestyle in the last month? Did you travel? Anything like
No.
that? No? Okay. Well, I'm going to go ahead and take your vitals since it's been a while since I've seen you. And then I'll look at your knee joints and also your feet as well. Okay? Okay. So, start with your blood pressure. Can I use this arm?
Yes.
Right. Okay, that's 110/62, so completely normal. I'm gonna slide this off. Okay. All right. Listen to your heart and your lungs next. Just breathe normally for me for now. Okay. All right, only as one MSD present. Listen on the bell side for murmurs. Very healthy sounds, no murmurs present. And listen to your lungs. If you don't mind just moving your arms a little bit. All right, take a deep breath in and out. Good. Deep breath in and out. All right, listen on the other side. Deep breath in and out. Deep breath in and out. Okay, sounds are normal. I'm going to grab your oxygenation. I could have your index finger. Make sure your legs aren't crossed. Okay. That is, heart rate is 87 beats per minute. Oxygenation is 94% at room air. So a little bit lower than what I'd like to see. And take your temperature. Okay. That is 97.9. Normal. All right, go ahead and look at me and let me know when the light enters your field of vision.
Now.
Okay.
No. 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 No.
Okay, good. Okay, now keep your head completely still and follow the light for me. Okay, very good. Any dizziness that you're experiencing along with this?
Yeah.
Okay, when does that occur?
What do you mean?
Dizziness?
When does it occur
Yeah.
in general?
Mm-hmm.
Oh, I had some dizziness now. That's what I meant to say.
So just now, but not in general.
No, I've never experienced that before.
Okay, that's a good thing. Okay. So I'm going to go ahead and move on to your feet, your knees and your feet, okay? So you can just stay right where you are. Okay. So first I'm going to do some simple movements with your knees and listen to how the joints are behaving.
Okay.
Listening for any creaking or popping. Okay, so you don't have to do anything on your own, just okay. Okay, now it's the left knee that you mostly have problems with, but this knee is sounding healthy, so that's a good sign. Alright, now I'm going to ask you to do some movements on your own. If you could lift and lower your legs slowly, just this one. Okay, as high as it can go. Go ahead and lower. Okay, good. And move it slightly to the left. Okay, and slightly to the right. Okay, very good. Now if you can move your knee up. Okay, and down. Alright, any pain doing that?
No.
Okay, very good. I'm going to go ahead and write that down. Alright, I'm going to grab a pair of gloves so I can just palpate the area. Okay. Alright, I'm feeling healthy. Joints and the tendons between the joints seem to be firmly in place. No dissension with the lower kneecap. A slight protrusion here. On the lower quadrant, but it does seem to be symmetric, so could be just the way that your bones are aligned. Okay, go ahead and just raise your foot. I'm just going to feel underneath here. Okay, and no pain on this knee when I do those motions? No. Oh, okay. Okay. I'm going to go ahead and look at the feet now. Okay. Just palpating here. Okay, wiggle all your toes at once. Okay. Try to lift your big toe. Okay, go against my push. On your next toe, go ahead and try to lift it. Okay, third toe, fourth toe, fifth. Okay. A little bit of atrophy here, but that's pretty normal in the sitting position. Go ahead and try to push this leg out towards me. Okay, now try to bend it back. Good. Now try to bring it in towards yourself. Okay, now pushing it outwards. All right. I'm going to listen to your ankles now. Okay, go ahead and roll your ankles. Okay. Okay, keep going. Sounds are normal. Okay, let's do it again. Alright, you can go ahead and rest that. Okay, I'm going to be looking at the feet more in depth later. But for now, just visually, your feet seem normal. No lumps, bumps, things to worry about. Symmetric in appearance, but I'll be measuring them a little here in a little bit. I'm going to move on to your problem knee. Okay. Hearing a lot of noises I don't like. Sounds like the joints are very inflamed. I feel also hearing a throbbing, which means there's a lot of pressure and blood flow pulsating in the area, which means that it's under some stress. Especially in this area. Just going to palpate. Does it feel painful when I touch this part?
Yes.
Sorry.
That's okay.
Painful here beneath the knee?
Yes.
Okay. Go ahead and try to lift your knee in the air. Go against my push. Your right knee only. Good. A little bit weaker. and the left. Try to bring it in towards yourself. And outwards. Okay. Going to raise your leg in the air. Try to lower it. Now try to raise it in the air. Okay. Definitely seeing some swelling here. Okay. I'm seeing that perhaps the knee became misaligned when you were exercising, perhaps. It seems it's very disconnected. The higher part of the calf is detached from the lower section. The tendons are still attached, so it doesn't seem like an issue that would be a broken knee, but you do need a lot of rest and therapy, so I'm going to look at the general appearance of the knee. Okay. Some redness here, but that's what I expected to see. Okay. Going to do some measurements here. Okay. Go ahead and lift this knee just very slightly. I'm just comparing symmetry to the other knee. Go ahead and lift that. Okay. And measuring the bottom of the kneecap all the way down to the ankle. Okay. Okay. So there's a little bit of variance here. This one. To the midsection, which goes a little lower. And seeing some asymmetry. Okay. Okay. That's it. And so the left knee is definitely more symmetric and uniform in shape than the right knee. Okay, go ahead and keep your eyes closed, and I'm going to be touching one of your knees with an object. Let me know if you feel the sensation on your left or your right knee, okay?
Right. Left. Left. Right. Right. Right.
Okay. I'm going to be drawing it all the way down from your knee to your ankle. Let me know if you feel it all the way.
Yes.
Okay.
Yes. Yes.
Okay, and I'm going to be doing a motion once, twice, or 3 times. Say 1, 2, or 3.
2, 3, 2, 1, 1, 3, 1, 1, 2, 1, 1, 1.
Okay, so those are just some basic sensory tests. You pass them, so you're not having any neurological issues with your knee. I'm going to have you lay down so I can take a better look at your feet and also do some movements of the knee to see if we can get it feeling better. Okay? I'm going to take an initial look here with the pen light. Looking at the skin surface can tell us a lot about what's going on underneath in terms of inflammation. Okay. Not seeing any purpling or redness. No significant swelling. No steatosis. If you look clean and healthy, don't see any lesions, warts, no fungus. So it's a good place to start. Okay. Checking for any debris or moisture that may build up at the tip of this tongue depressor. Do you ever have excessive sweating of the feet?
Sometimes, yeah, especially in the morning.
In the morning, do you wake up with very sweaty feet?
No.
So after you wake up?
Yeah.
Okay. And seeing some moisture build up and just a little bit of clamminess here. Okay. Not so much on the top. Okay. And definitely some more sweating on that left side. Doing a moisture reading. Okay. Actually, this is normal levels. Let's try the other foot. Okay. So the left foot is a little bit higher in moisture. Usually it's best to have both sides symmetric in this quality. So I'm just going to take note of that. I'm going to apply an antiseptic spray, an ointment for the body that's going to help decrease any swelling and moisture that you're having down there. And it just helps with general inflammation. That's because I'm seeing some of this inflammation of the rise in muscle mass and some swelling right in the forefoot beneath the beginning of the metatarsals. So I'm just trying to really make sure that we take care of that. Okay. I'm going to be mixing it in with some other ointment just for sore muscles. And mixing it with the other leg, the other foot, I mean.
I'm going to do some measurements to see if the symmetry is a little bit better. A little bit. Yep. Okay. Okay. I'm pretty pleased with these results so far. Just gonna see here. The skin seems even and elastic. Okay. Just going to apply some pressure point therapy before I move on to just some very gentle knee adjustments. Okay. This helps to circulate blood flow. Okay. Next I'm going to do a gentle knee adjustment, and we'll go ahead and talk about how that went for you. Okay. So I'm going to be lifting your right knee.
go ahead and place it here. I'm just going to be stretching it. Okay. I'm doing some very light rotations. Okay. All right, go ahead and lift this one. Doing some rotations again. Very gentle. All right, and lastly, I'll just be doing some pressure point therapy to the knee area. Okay. All right. I think this concludes our exam. Do you have any questions?
No,
How did he feel?
it feels a little bit better.
That's really good. No suspicious filaments or debris, no unholy sediments. Okay, if you go ahead, turn around, brace that wall, and let me see the back of your feet. Okay, let me see the back of your feet. Okay, so surprisingly enough, that's all clear. I'm just going to take a look at your luggage and you'll be on your way. Oh. Hi, Kate.
Hi.
How are you today?
I'm okay. How are you doing?
I'm very good. So I see that you're here because you've been having some foot and leg pain.
Yeah.
Could you describe that?
Yeah, I was playing volleyball a few weeks ago and I went down really hard on my left knee.
Left knee?
But the pain kind of shut down and now it's more in the calf and foot area.
Okay.
But my other side is kind of bothered too, so
Okay.
I don't even know if it's that or an unrelated problem.
Sure. Did the calf and foot pain occur at the same time after the injury, or?
It was more in the calf, but then a few days
Okay.
later both my feet started to hurt a lot, so I
Okay.
don't really know what to think.
It could have been something that impacted your feet at the time, but you didn't feel it until later. Definitely, it sounds like you have a calf injury. Have you done anything for the pain?
Taken some Tylenol, taken a hot bath,
Okay.
used some ice, but nothing really helps for more than a few hours.
Sure. Okay. Have you been resting?
Yeah.
Good. I have to ask, is it difficult to walk?
Yeah, it's definitely had me.
Okay.
I'm kind of adjusting my usual gait, I feel.
Sure. Does it feel very painful when you go down the stairs?
Yeah.
Okay. And are there any times of day that hurt more than others?
Definitely at night before I'm about to go to bed after a long day.
Evening. Does that make it hard to sleep? I'm sure. Okay. Have you noticed any numbness or tingling sensations?
Yeah, definitely some numbness in the just general calf and foot
Okay.
area.
Any numbling?
Yes.
Okay. So I'll check on that. And would you say that you ever feel like a throbbing sensation or a sharp shooting pain, or is it just general soreness and achiness?
General soreness and aching.
Okay. Have you noticed redness or swelling in the area?
Definitely on the left side.
Okay.
On the left leg, I mean.
So red and swelling. Okay. Well, it's been a few months since I've seen you, so I'm going to go ahead and get your vitals just to make sure that you're doing well.
Okay.
And then I'll go ahead and focus on your feet and your calf, okay?
Okay, thank you.
Any questions for me? Okay. Go ahead and start with your blood pressure. Okay. Okay. So it's a little bit low. It's 92/60. Oops. Okay. listen to your heart, your lungs. Okay. All right, just breathe normally for me.
Okay.
Make sure your legs are uncrossed at the ankles, okay? Okay, sounds normal. And then we'll sit on the bell side for murmurs. Okay, no murmurs present. Good. Let me get your temperature as well. Okay. .1, that's perfect. Okay. I'm going to go ahead and just palpate your face. Okay. Okay. Alright, so just relax. I'm just going to feel for signs of swelling or edema. Let me know if you feel any sharp pain or soreness. I'm going to check the lymph nodes. Okay. I'm going to feel beneath your eyes and the sinus cavity is. Okay. Go ahead and try to lift your eyebrows for me. Good. Try to lower them. Good. Turn your head to your left and to your right. Try to look up at the ceiling. Good. Toss your chin to your chest. Good. Good. Feel your irregular lymph nodes. Irregulars are non-palpable. Post-irregular is also non-palpable. Very good. Okay. So what I'm going to do now is just have you lay down on the bed. I'm going to just take a look at your feet and also your calves and just assess with measurements and sensory tests what's going on and hopefully apply some treatment.
Okay, thanks.
Okay, all right. All right, so I'm going to start just by taking off your socks. Alright, just going to be palpating your feet. Okay. Definitely feeling a lot of swelling here in this left foot. It's definite signs of edema. And is it painful when I press here on the inside?
Just a little.
Okay, and on the outside here?
Just a bit.
Okay. Feel the outside as well.
definitely more swelling on the left foot. I'm going to just take some therapeutic enclosements just to separate the feet, to give you some cushioning while I measure and run sensory tests. Does that feel comfortable?
Yes, it does.
Okay, good. Okay. Okay, just going to take a few measurements to determine the level of swelling. So just measure all the way around here. The tops, that's 8 centimeters. Okay, on the other side. That has 26, so definitely more swelling on the left. Okay. Okay. Just measure the length to make sure you're wearing the right size shoe. 20.5 here. And 28.5. So they are symmetric. Okay. Measure the sole hat here. 9 centimeters. 8.5. So I'm seeing some edema on the width as well. Okay. I'm going to start here. 30. Okay, so some inconsistencies. If you could just lift your foot very gently. Start with this one. Go ahead and rest it. Yeah, okay, you can lift it again. That was 30 centimeters. On the right side. Go ahead and lift your left leg. Okay, that is 31.5, so not as much swelling in the ankles as I thought. Still gonna write that down. Okay. Alright, just gonna do some percussions as well. Swelling on the left side. Okay. All right. Go ahead and try to
Bring your feet up towards yourself, starting with the pads of the feet, so like stretching up. Good. Now push against my gloves, try to point your toes. Good. Now try to spread your feet as wide as you can or as hard as you can. Good, okay. Some limited strength there. Now try to bring them together. Okay. Okay. Just going to look at the tops of the feet for any signs of skin irregularities. Normal here on the left and normal on the right. I don't see any excess dryness. Moisture level seems to be perfect. Okay, I'm going to do a couple sensory tests. So this is going to be a sharp sensation. This is dull. Say sharp or dull.
Gotcha. Dull. Sharp. Sharp. Dull. Dull. Dull.
Good. All right. Going to do a couple of tests with a tuning fork. You're going to feel a vibration right here on the feet. I'm going to go up along the bone. Let me know when the vibration stops for you. Pay more attention to the feeling of it and how it sounds, okay?
Okay.
Okay.
No.
Good.
No.
Okay.
No. No. No.
Good. Okay.
No. 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 No.
Okay. Excellent. I think that's all of the sensory tests I want to do. I just want to apply a few different methods of treatment to try to decrease swelling, and then we can talk about how you're feeling, okay?
Okay.
I'm going to start by just applying some oil. Okay, it's going to be just a little bit here. This contains menthol and arnica gel just to help decrease the swelling. Okay. Okay, and while that's setting, I am going to take a sample. Okay.
feet as well. So I'm seeing some dryness here, just to make sure that the flaking is normal, dead skin and not any kind of fungus. Okay. I'm going to just set that in. Okay. Okay. All right, just one more to make sure we get the area above the feet. Just going to make sure that we have a good collection here. Seeing some redness here in the calves. Okay. All right. Going to just wipe off some of the excess removing some of the moisture here. All right. Before I apply, before I apply the pressure point therapy, I'm going to just be getting in between the toes with some very, very strong antiseptic treatment. Okay. Hopefully it's going to set very well. You can just relax.
some pressure in the areas between the joints. Okay. Moving the separators on this foot. Okay. Okay. And some pressure points here just along the foot area. Okay, so hopefully that released some tension. Just going to use a little bit of serum and cupping. And this really aids in the suctioning of the skin.
skin absorb the collagen flakes. And going on to this. Alright, so hopefully that provided a little bit of relief for your feet. I'm going to move on to an assessment of your calves and see if I can just apply some anti-inflammatory treatment there. Okay, and to assess the calves, do you mind if I raise your pants?
What?
Okay. Okay. A little bit of blankage here. Now I'm sensing a little bit of edema. Okay. Great. I'm going to do some measurements just with a different implement. So I'm still here. Okay, this is 33 centimeters. Okay. 32, so about the same. Okay. This is 25. On the right side, and the left is look. 29. Definitely you have some swelling in the calves. Okay. Just going to take a couple different metrics here. This is the knee. 29. Okay. 32. So some swelling below the knee as well. So the same. Just wanted to double check that. Okay, I think I have pretty much what I need here. Okay. Go ahead and let me know when the vibration stops, okay?
Okay. No.
Okay.
No. No.
Excellent.
No.
No. No. No.
Okay. Okay. This time, This time we're going to do sharp or soft, okay?
Okay.
So this is sharp. And this is soft. Go ahead. Say sharp or soft.
Soft. Good. Sharp. Sharp. Soft. Soft. Sharp. Sharp. Soft. Sharp. Soft. Sharp. Sharp. Soft. 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 Sharp. 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 Soft. Soft. Soft.
Very good. Okay. And this will be one pressure point. This will be 2. Say 1 or 2.
1, 2, 2, 2, 1, 1, 1, 2, 2, 2, 2, 1.
Okay. Right. I'm going to just apply a few techniques to decrease the swelling. First, I'll start with some oil for the base. Then I have a couple wooden tools. Okay. Just trying to decrease inflammation. Some of these things. Is this comfortable? Okay.
Okay. Let's apply some detoxifying exfoliation to help with some of the redness of the skin. Okay. Almost done. be wiping this off with some water. And finishing with some medicine balls. All right, Casey, that concludes our session for today. Hopefully it's a lot more relaxing for you and you will begin to heal. I'll give you a follow-up call in a few days, okay?
Thank you so much.
Sure, thanks for coming in and allowing me to do this exam.
Thank you.
All right. To apply the bergamot oil to the toes. Followed by some exfoliation.
Does that hurt?
No.
Okay, let me know if it does, so I can go softer.
Okay.
Increasing circulation and relieving any swelling that might come from strain placed on the feet by thermal tension. Activating vibration receptors through the extremities just so you can relieve any numbness or loss of circulation. Just should feel vibrating and warm. Okay, so Casey, I'm going to have you flip over right now so I can begin the cupping therapy and massage techniques on your back, okay? Okay, all right. Hi, Casey, how are you today?
Hi, I'm okay. How are you doing, doctor?
I'm very good. So, I see in your appointment log that you are here because you're having some mobility, knee or foot problems.
Yeah, I I've been noticing a lot of pain in my left knee.
Left
Also
knee?
in my right foot. I don't know if it's like related, like because my knee hurts, I'm compensating with my foot or vice versa.
Yeah.
They both started hurting around the same time too. So I
Okay.
don't even
Sure.
know which problem happened first.
Is it the same type of pain in the knee and the foot?
It's a little bit different. It's like my knee has a more sharp pain
Okay.
when I bend it, and
Okay.
my foot is more of like a numb, tingly.
Okay. So your right foot has numb and tingling. Do these sensations come at the same time?
Yes and no. It depends. Like if I'm walking, it probably bothers me a little bit, but if I'm just sitting, the knee doesn't really bother me. It's only when I'm moving, but the foot is kind of numb and tingly no
Okay.
matter what I'm doing.
Okay. Is it comparable to like when your foot falls asleep or
Yeah, but a little more annoying than that, like a little more painful, I would
painful?
say.
Okay. And when did this begin? You said they started at the same time.
Yeah, around like 3 weeks ago.
Okay. Did you have a change in the shoes that you wear?
No, I don't think so.
No. Okay. And did you have any kind of incident where maybe you had a weird workout where you sprained something or exerted, maybe went on a hiking trip, did something physical that you don't normally do?
I have been using the stair climber at the gym a lot, but I don't know.
Okay.
It wasn't like one moment of horrible pain. or
Sure,
anything.
yeah. It could be a buildup of strain on maybe your left knee, and perhaps the foot is trying to compensate for it in some way, walking in a different way that causes that to exacerbate. So I'm going to be looking into both situations. I'll be looking at both knees and both feet. First, do you have any allergies to medications?
No.
Okay. And any family history of blood clots?
No.
Okay. Heart or lung disorders?
No.
Okay. All right. Joint problems?
No.
Okay. And how often do you exercise? Like, what's your level of physical activity per day?
I'd say like an average of 2 or 3 times a week.
Okay.
I go to the gym.
Is it aerobic exercise or weightlifting?
It's like walking on the treadmill.
Okay,
Burst, and I
so
started
just
the stair
walking.
climber. Yeah, nothing like super strenuous.
Sure, sure. All right. Okay. I think I have all that I need to know. I'm going to start just by taking your vitals because it's been a while. And then I go on to an assessment of your knees and feet. Perhaps applying some treatment if I find some swelling or some outer symptoms that I see that could be fixed with solution or pressure point therapy, things like that.
Okay.
Do I have your permission to do that?
Yes.
All right.
Great.
So I'm just going to start by palpating the knee, okay? So this is the right knee, it's the one that's not bothering you. Okay, still let me know if you feel any sharp sensations, okay?
Okay.
Just want to make sure you have a good idea of the structure of this kneecap to compare symmetry. Okay, I'm going to be pressing on different areas of the knee. Let me know if you feel any pain.
Okay.
Pain here.
No.
Pain here.
No.
Okay. Pain. All right. Pain.
No.
Pain.
No.
Okay. Pain.
No.
Pain.
No.
Okay. Okay. Do some of this.
centimeters here. I'm not seeing any swelling. Okay. Okay. Just checking for edema. Your reflexes are normal. Okay. 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 Go ahead and close your eyes. I'm going to make a short scraping motion just from the top of your knee down. Let me know if you feel that once, twice, or 3 times, okay? Just say 1, 2, or 3. Okay. 2. 1. 1. 3. 3. 2. 2. 2. 1. 3. 1. Okay. Okay. And I'm going to be drawing the stick from the bottom of the kneecap to the top. Let me know if you feel it equally on both knees. So really focus. Yes. Okay. Top to bottom. Go ahead. Let me know. Yes. Okay. Side to side. Let me know if it's equal. Yes. Okay. Very good. Okay. So far, so good. I'm going to use 2 different vibrating tuning forks. Let me know when the sound stops, okay? Okay. Or when the feeling stops. You should feel a vibration. If you just hear the sound and don't feel the vibration in your knee, let me know that too, okay? Okay. Do you feel it? Yeah. No. Okay. Do you feel it? Yes. No. Okay, that was a little delayed. Let's do that again. Same thing. Yes. No. Okay. Some slight delay in response on the inner knee of the right foot. Come to the outside.
Okay, doing the same thing as this tuning fork, just has a different vibrational frequency. So let me know if you feel it and when it stops.
Okay.
Do you feel it?
Yeah. Now.
Good.
Yes.
Okay.
Now. Yes.
Do you feel it?
Now.
Good.
Yes. Now.
Excellent. So I'm going to do the same thing, only on the other knee. And this time it might take a little more time because it's the one that's giving you pain. Now, as I palpate this knee, you're probably going to feel some pain. But let me know if it gets higher than an 8. If it's excruciating, very sharp, very sudden. I'd like to know that, but yeah. Okay, pain here?
Yeah.
Okay. Pain?
Yeah.
Pain.
Not as much.
Okay, so it is in the lower left quadrant. I'm going to glide my fingers across your knee at about the same pressure. Let me know if the pain increases or decreases or stays the same.
It decreased.
Decreased? So you say the pain is more on the outside of the knee?
Yeah.
Okay, what about here? Pain?
Not as much. Yeah, a little, but not as bad.
Not as bad. What about here?
Yeah.
Okay, is it about equal to the other lower side of the knee?
A little bit less.
Alright, so we might be having a lower kneecap injury, some musculature near the bottom of the knee on that joint. It's probably irritated. What about here, pain?
A little.
A little, okay. I'm going to be pressing right on the kneecap. Pain?
Yeah.
Okay, I'm sorry about that. So on a scale of 1 to 10, what would this pain be?
Probably like a 6.
A 6, okay. What about now?
Like a 5.
Okay, alright. I'm actually going to listen to that joint and move it around very slightly just to listen for signs of creaking, popping, or just abnormal sounds going on.
Okay.
So you don't have to move your knee at all. I'm just going to be guiding it for you. Okay. A little bit of creaking here. Just some sounds of musculature strain. No popping, so I don't think you pulled anything because you are still able to walk. Okay. Okay, just up and down. You should move your knee up and down, your lower leg up and down for me 3 times. Just gonna listen to different sections. That's 1. Okay. Go ahead, 2. And 3. Okay, 1 more. Okay. Okay. So as I move this knee in, is it more painful than moving it out? Or less painful?
Less painful.
Less painful. Okay. So I think I've pinpointed the area of your injury here. I'm going to do some measurements here as well. Okay. And 21 here, which is comparable. Not noticing any major edema for now. Okay. gives me here, I'm just going to move around again. And that is so slightly, just going to be more swelling here, which is normal for the level of injury that you have. Okay, so we're going to do the same scraping test on this knee. Say 1, 2, or 3, depending on how many you feel.
Okay. 2, 3, 2, 1, 1, 2, 1, 3, 2, 1, 3, 1, 1, 1.
Okay. And last, we're going to do that same vibrational test, only on this other knee, starting with 128. So close your eyes and let me know if you feel that sensation and when it stops.
Okay.
Do you feel it?
Yes. No.
Okay. Do you feel it?
Yes. No.
Good.
Yes. No.
Good.
Yes. No.
Good. Okay. Just a couple more. Feel it?
Yes. No.
Good.
Yes. No.
Okay. Going to do 256. Do you feel it?
Yes.
Did it stop?
Yes.
Good. Do you feel it?
Yes.
Did it stop?
Yes.
Okay. Do you feel it?
Yes. No.
Okay. One more. Do you feel it?
Yes.
Did it stop?
No. Okay.
Okay. So, before I have you lay on the bed, I'm just going to move down to your feet and just do some joint exercises. I'm going to do a very in-depth examination of your feet, but that'll be more when we lie on the bed, okay?
Okay.
Any questions so far?
No.
Okay. Now, Kate, see, do you mind if I remove your socks?
No, go ahead.
Very good. Okay, just taking a look. Do you have circulation issues ever?
No.
Okay, so your feet don't get cold or...
I mean, a little, but I think it's normal.
Okay. All right. All right. So your right foot is the one with the issue. I'm going to start just by palpating.
Okay.
Okay. Let me know if you feel pain. I'm going to go through each toe and just make a circular motion.
Okay.
Okay. Pain here?
No.
No? Pain here?
Yeah.
Okay, on the second toe. It is taller than your large toe, completely normal, but that might be causing some issues too with hitting against the shoe.
Okay.
Pain here?
Yeah.
Okay. Pain here?
A little.
Okay. And pain here?
No.
Alright. I'm going to squeeze the pad of your foot and the heel. Let me know which sensation is more painful, okay? Here's your pads. Here's your pads, and here's your heel.
The pad.
The pads, okay, that's what I suspected. Alright. Okay, I'm going to do some very simple foot myotomes. Try to bring, leading from your foot, try to bring this right foot in towards to touch the other one. Okay, 3, 2, 1. Okay, is that the hardest you could go?
No.
Okay, let's do it again. 3, 2, 1. Harder, as hard as you can go. Okay. A little bit of atrophy here that I'm seeing. Okay. Try to lift the big toe and resist my push down. Good. Now lift it as high as you can. Okay, lower it. Okay, lift that second one. Up, up, up high. Lower. A lot of atrophy here. I am kind of detecting some swelling. Okay, lift the third. Lower. And lift. Lower. And that last one, lift. And lower. Okay, great. Can you point your feet like a ballerina? Okay. And flex. Okay. And in doing that, with your pain on a scale of 1 to 10, what number would that be?
Like a 5?
5, okay. 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 Going to just be rotating your ankle, listen for creaking or popping. Some slight creaking here in the outer joint. Going to be placing it right underneath the toes. Okay. Okay, some significant creaking here. Okay. It's not as red as I thought it would be, but I am seeing some kind of pinkish hue appear, especially right underneath that second toe. I'm just going to take note of that for when I do the treatment. Okay, so next I'm going to palpate your healthy foot. Let me know if you feel any pain at any point.
Okay.
Alright, rest that foot right there. Try to bring it in towards your right foot. 3, 2, 1. Try to bring it in. Good, now try to push it out. Okay, try to lift this foot in the air. Try to lower it. Okay, very good. Okay, we're gonna do toe by toe, lift, lower, lift, lower, a little bit stronger here, lift, and lower on the third, lift, lower, lift, and lower. Okay, can you roll your ankle all the way around once just on that foot? Alright, any pain?
No.
Okay, so if you don't have any other issues creeping up here on this foot, I'm happy with what I have so far. I'm going to lay down in the bed, do a few more measurements and tests, and then apply some treatment for you. Okay?
Thanks, doctor.
Sure. So I'm going to make some measurements of the feet just to look for signs of symmetry, okay? Feet here. Feet here on the right. Okay, let's do the opposing side. That's 8 inches here. Okay, just gonna look here. 1, 2, 3. And 1, 2, 3. Pretty normal. Right foot measures half an inch larger due to edema from upper pedal strain. Okay, toes here. Inch and a half. Inch and a half. Large toe symmetric. Okay, second. 2-inch, 1.5. So that's probably why it's giving you so much trouble. Its second toe is slightly elongated compared to the one on the left. Okay. 2 inches here. 2 inches here. Spreading so the span symmetric. Let's see, 3 3/4 on the right, and on the left is, let's see, 4 inches, 1.5 here, 9. Okay. Gonna measure the circumference. 9 here. And okay, a whole inch difference. So this right foot is very swollen. I thought that it was just slightly swollen, but we have an inch difference in circumference, so that is indicative to a moderate to severe muscular strain. Okay, it's really good to know. For comparison, measure the pads, 7 inches here, and okay, so it's only 7 1/4 up here, so even though your pain is a lot in the upper area, the swelling, the compensation, the edema is taking place in the center of the foot. Good to know. Okay, so definitely you will benefit with some pressure point therapy. Seeing a little bit of flaking here, so I am going to take a sample. Okay.
going to be going in between the toes. Okay. Okay. And number 2. Okay, go ahead and loosen this one here. Go ahead and add that to the sample. Okay. Okay, before I apply some inflammatory oil and apply treatment, I am going to do a few sensory tests, okay? So you're going to feel a puff of air on your feet. Let me know if you feel it once, twice, or 3 times.
Okay. Once. Once. Once.
Okay, again.
Twice. Twice. 3 times.
Okay, and again.
Once. Once. 3 times. Twice. Once. 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 Twice. Twice. Once. 3 times. Once.
Okay. I'm going to do a warm or cold test. This will be warm. And this is cold. So go ahead and say warm or cold.
Cold. Cold. Cold.
Sorry.
Cold. Warm. Cold. Warm. 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 Cold. Cold. Warm. Warm. Cold. 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 Cold.
Next, we're going to do a pressure point test, okay?
Oh,
But before that, I am going to apply some no-rinse cleanser just for sterilization, since I have touched your feet with a few tools, and this will help free up your skin sensitivity. It's gonna feel cold. Okay. Okay. Okay, so I think the skin is pretty thoroughly cleansed now. Let me go ahead and just take a look just to see what other ointment I need to apply. Yes. Okay. The right foot would benefit probably from some eucalyptus-based tourniquet gel, which I do have in stock today, so I'm going to go ahead and apply that after I finish the sensory tests. Okay. Okay, other than that, the skin looks pretty healthy. Okay. So let me know if you feel 1 or 2 pressure points, okay?
okay.
Okay.
1, 1, 1, 2, 2, 2, 2, 1, 1, 1, 1, 2, 2, 1, 1, 2, 2, 2, 2, 2, 2, 1, 1, 1, 1, 1, 2, 2, 1,
Good.
2, too.
Okay. All right. And this next test is sharp or dull. This is a sharp sensation. Do you feel it?
Yes.
Okay. And this is dull. Can you tell the difference?
Yes.
Okay, go ahead and let me know if it's sharp or dull.
Okay. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. 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 Dull. 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 Sharp. Dull. Sharp. 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 Dull. 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 Dull.
Okay. I'm going to apply some phosphorus-based serum just to the outer edges of the feet, and it's going to help in maintaining the pH balance of your skin, which is important when recovering from an injury. I didn't hear any creaking or popping, but if the pain continues after this, definitely we'll go along the route of ordering x-rays. But since that you are walking, it just seems that this is not an issue of joint or bone breakage. It just needs to be properly treated. So that's what we're doing today. Okay. Okay, and next I'm going to be just applying some of the arnica. Okay, it's just going to feel oily and slimy.
Okay. I'll be applying a variety of wooden techniques to just oxygenate the tension beneath the muscles. Okay. This is just to help with the inflammation. It's also all natural based products, so it shouldn't be hurting you in any way in terms of topical strain. Okay, going to the right one. Okay.
completely relax and remember to breathe. Just separating each tarsal through isolative wooden pressure. A lot of swelling here on the right foot, so I'm just really gently kneading into the areas that need to be addressed. And I'm already seeing a little bit of redness here, which is normal in the coming days, but you should not have any increased pain. Okay. I'm just going to try cracking the toes gently. Just relax, you don't have to do anything. Okay, don't do the other foot. Okay. Looks like they're not wanting to crack today, but that's okay. It's still a release of pressure. Okay, good. Okay. Okay. Wipe off the excess oil before I just do some vibrational and tapping therapy. There we go. Gonna do some tapping now. Okay, Casey, how did that feel for you today?
Amazing. Thank you so much.
Good. I'm glad we relieved some of your tension and eliminated anything serious. I am going to ask you to take a rest from exercise and non-essential walking just for the next 2 weeks while this heals. I'm going to just prescribe you with some Tylenol to take for inflammation and pain, and I'm going to send you home with that phosphorus serum. Also, I'd like to see you for a follow-up in a week, just to make sure we're on the right track of healing, okay?
Awesome. Thank you so much, doctor.
Thank you for letting me do this exam today, okay? Go ahead and get up on your own time.